Vitamin D. Vitamin D is a nutrient that your body requires to build and maintain healthy bones. This is due to the fact that your body can only absorb calcium, the primary component of bone, if vitamin D is present. Vitamin D is also involved in the regulation of many other cellular functions in your body. Its anti-inflammatory, antioxidant, and neuroprotective properties help to maintain immune health, muscle function, and brain cell activity. Although vitamin D is not naturally found in many foods, it can be obtained through fortified milk, fortified cereal, and fatty fish such as salmon, mackerel, and sardines. When direct sunlight converts a chemical in your skin into an active form of vitamin D, your body produces it as well, calciferol. The amount of vitamin D produced by your skin is affected by a variety of factors, including the time of day, season, latitude, and skin pigmentation. Depending on where you live and how you live, vitamin D production may decrease or cease entirely during the winter months. While sunscreen is important for preventing skin cancer, it can also reduce vitamin D production. Many elderly people do not get enough sunlight and thus have difficulty absorbing vitamin D. If your doctor suspects you aren't getting enough vitamin D, a simple blood test can determine your vitamin D levels. Taking a multivitamin containing vitamin D may benefit bone health. The daily recommended amount of vitamin D for children under the age of 12 months is 400 international units, IU, 600 IU for people aged 1 to 70 years, and 800 IU for people over 70 years. According to research on the use of vitamin D for specific conditions, cancer is a disease. The research on the benefits of vitamin D for cancer prevention is conflicting. More research is needed to determine whether vitamin D supplementation may lower the risk of certain cancers. Mental health. According to research, low levels of vitamin D in the blood are linked to cognitive decline. More research is needed, however, to determine the benefits of vitamin D supplementation for cognitive health. Bone disorders that are passed down through families. Vitamin D supplements can be used to treat inherited disorders caused by a lack of vitamin D absorption or processing, such as familial hypophosphatemia, multiple sclerosis, MS. Long-term vitamin D supplementation may reduce the risk of multiple sclerosis, according to research. Osteomalacia is a type of bone disease. Vitamin D supplements are used to treat adults who have severe vitamin D deficiency, which causes bone mineral loss, bone pain, and muscle weakness. Osteoporosis is a type of bone disease. According to research, getting enough vitamin D and calcium in your diet can help slow bone mineral loss, prevent osteoporosis, and reduce bone fractures. Consult your doctor to see if a calcium and vitamin D supplement is necessary to prevent or treat osteoporosis. Psoriasis is a skin condition. In some cases, applying vitamin D or a topical preparation containing calcipotriene, a vitamin D compound, to the skin can treat plaque-type psoriasis. Rickets are a type of ricket. This uncommon condition occurs in children who are vitamin D deficient. Vitamin D supplementation can both prevent and treat the problem. Generally safe, your bones can become soft, thin, and brittle if you don't get enough vitamin D. Vitamin D deficiency has also been linked to osteoporosis. If you don't get enough vitamin D from sunlight or food, you may need to take vitamin D supplements. Vitamin D is generally considered safe when taken in appropriate doses. Taking too much vitamin D in the form of supplements, on the other hand, can be harmful. Children aged 9 and up, adults, and pregnant and breastfeeding women who take more than 4,000 IU of vitamin D per day may experience vomiting and nausea, loss of appetite and weight, indigestion, the flaw, perplexity and disorientation, problems with heart rhythm, kidney damage and kidney stones. Interactions that may occur include the metal aluminum. Taking vitamin D and aluminum containing phosphate binders, which may be used to treat high serum phosphate levels in people with chronic kidney disease, may result in harmful aluminum levels in people with kidney failure over time. Anti-convulsants are medications that are used to treat seizures. The anti-convulsants phenobarbital and phenytoin, dilantin and phenatec, increase vitamin D breakdown and decrease calcium absorption. Atorvastatin is a statin medication, Lipitor. Taking vitamin D may affect how your body processes this cholesterol medication. Calcipotriene is a type of calcipotriene, Dovanex, Sorelux. Take no vitamin D with this psoriasis medication. The combination may raise the risk of having too much calcium in the blood, hypercalcemia. Cholestyramine is a type of cholinesterase inhibitor, Prevolite. Taking vitamin D with this cholesterol-lowering medication may reduce vitamin D absorption. Substrates for cytochrome P453A4, CYP3A4. If you are taking drugs that are processed by these enzymes, use vitamin D with caution. Digoxin is a type of antibiotic, Lanoxin. When taking this heart medication, avoid taking high doses of vitamin D. High vitamin D doses can cause hypercalcemia, which increases the risk of fatal heart problems when combined with digoxin. Diltiazem is a medication that is used to treat high blood pressure, Cardizem, Tiazac, others. When taking this blood pressure medication, avoid taking high doses of vitamin D. High vitamin D doses can cause hypercalcemia, which can reduce the drug's effectiveness. Orlistat is a weight loss medication, Xenical, Ali. Using this weight loss medication can reduce your absorption of vitamin D. Steroids are a type of steroid. Steroid medications, such as prednisone, can reduce calcium absorption and impair vitamin D processing in your body. Laxative stimulants. Long-term use of stimulant laxatives at high doses can reduce vitamin D and calcium absorption. Verapamil is a type of medication, Veralin, Kalin SR. Taking high doses of vitamin D with this blood pressure medication can cause hypercalcemia and may reduce verapamil's effectiveness.